My last year of chiropractic school, my mom got diagnosed with cancer, and unfortunately it was a very aggressive, just really tragic kind of thing, but it was about an 8-month course of diagnosis to passing away. It's emotional for me. But anyways, in walking through that with her, I really was not only devastated just personally from kind of watching somebody go through that, but as I then kind of learned further in school and even got into my career, really was devastated by the lack of care. Not caring, there's great doctors involved, but in 8 months of dealing with cancer, there wasn't a single conversation about diet. She didn't have annual blood tests that were comprehensive in any kind of way. She had a lot of long-standing GI issues and some hormone problems, and just stuff that was just kind of like, this is what I have, kind of thing. So it's a pretty typical story, but I just really committed personally to try to help people get away from that trajectory. And I think what's frustrating about, some of that experience, it's turned into positive for hundreds and hundreds of patients at this point that I've been able to impact. But what's frustrating is that you can see that stuff coming if you look. And, with the right interventions and the right kind of person in your corner, just a lot of this stuff's avoidable or correctable if it's already kind of going the wrong directions. So I'm just really passionate about that, just from personal experience. And so I got into a place where I kind of early on, I went and pursued postdoctorate education in spinal biomechanics. So I have extra certifications in kind of like really advanced correction of spines. But, so what if they still have diabetes, or so what if that person still dies of a heart attack? So to me, it's kind of like, if not me, then who? Having been taught some of the things I've been taught and just had the experiences I've had, I just kind of feel like there is kind of like an honorable burden. I feel really honored to carry that, but I just think if we have the knowledge, the tests exist, the treatments exist, and your body's made to heal, it just seems like treating people in this sort of holistic way is really how it has to be.